With Ardent Solutions not long ago. I just started in September, and it's a fantastic organization so far. They do a lot of really great things. But I came in as an HM associate to pretty much all things Uniper, which has been an incredible trail up till now. So, well, it continues to go. But the Uniper is a very simple subscription service. And we don't like to say technology or the platform or anything like that because, older adults, they sometimes fear technology. They're kind of stuck in their ways, as I am as well. So when we are going into outreach, all different areas to try to pass the word along that we have this program. So we're really counting on our partners to help us do that. So with that being said, I will dive right in. So the eligibility criteria for a Uniper from us is basically age 50 and older, and you have to live in Allegheny, Steuben, or Sagamore County. We have up to 75 units to place. After that, we will discuss whether we need to add more. We can take a waiting list. We just haven't gotten that far yet. To date, we have 34 green TVs installed in people's homes. So once we find somebody who is interested in the Uniper and would like to have it in their home, they deal with us. They don't deal with another organization, anybody else. They deal with me or Jose or my partner Melissa. So that's very nice that we keep that right in home. We schedule a home visit risk assessment so that we're all safe to go into a home and take a quick intake. The information that we ask is not a lot. Basic demographics is all we require. And we require that they take a PHQ-9 survey, patient health questionnaire survey, and a UCLA low maintenance skill test. Every 3 months, 6 months. Initially, and then we follow up in 3 months. That kind of helps us see if it's making a difference once they've gotten it, and then it's designed to combat loneliness and isolation. So the Uniper consists of this little box. They have to have a television with a HDMI port. It's sometime here. But if they do not have television, or they do not have a television with an HDMI port, that is something that we can provide as well through the grant. We can also use the Uniper on a tablet. If we don't have a tablet, or they prefer to use the tablet, we have those that we can provide as well. And then, of course, in rural areas, internet is always an issue. It doesn't reach all the areas yet. So we have Verizon hotspots that we can provide for them to run their neighborhood. So those seem to be working very well. I haven't really had any issues where it hasn't worked. And then we do have some AT&T through Uniper that we can use as well if that's required. We haven't had that one yet. So again, we just have this little box and an HDMI cord. They have a camera that can be installed to the box. One of the features on the Uniper is that they can connect with their families and friends and do a video chat. Once they get it, they can add their friends and family to the list, and their family can call them. They can call out directly from their remote and their television. Okay, I'm trying to tell you one. So you want to go? Oh, you're there. Okay. All right. So this is when me turn the lights down.
It's a cool thing.
Can you ask questions?
Absolutely.
If you can, you said you can talk to a friend or relative. Does that friend or relative have to have a Uniper system also?
They do not, actually. They have to have a cell phone.
Okay.
It's an app. And I'll go through all of that, each feature of the Uniper as we go along. So when you open up the Uniper, it usually says, good morning, Deanna and Alex. What would you like to do today? The first thing they'll see is my schedule. So if they go into this schedule, and with that, I'll have you look at this piece here. So we provide these monthly. to everyone who has the Uniper. And these are the monthly classes, live classes that they can join. So on the screen, it gives you 6 days out. So today, happening right now from 10 to 10:55, body moves for better health. So each exercise class or yoga class has an intensity level. So goes from chair yoga, chair exercises, all the way up. And then on your list here, you'll see all of the different categories that they offer for live classes and the times and days that they're offering. So that's got art and music. They've got games. There's Jeopardy that they can participate live and actually, answer the questions and interact with other people with that. There's a Name That Tune trivia every week. It's a lot of fun. We really like those things. And then the conversation, my favorite is coffee chat. So I was recently with a woman who didn't know if she really liked it. She was a little leery, so I joined coffee chat with her. And we didn't turn our camera on because you have that option. They don't have to use the camera. A lot of people are shy. They aren't comfortable being on camera. And they don't have to use the speaker. They can just simply join and watch and listen and participate that way. But we watched participated in the coffee chat, and there's usually a different topic, and the topic of the day was how to bake a baked potato. Very simple. But the conversation that came out of how to bake a baked potato was hilarious. We laughed so hard, and it just really got her excited about joining that coffee chat every day. So we like to try to find that one thing that they can benefit out of the Uniper, even if it's just one thing. So yeah, those are the live classes. Like I said, there's exercise, they have balance and fall prevention, health and nutrition, so there's cooking classes, there's nutrition classes, and then we have travel the world. So they basically do virtual field trips, and they teach you all about all of the different countries, any country that you might be interested in. There's relaxation time, which is through yoga, different relaxation techniques that they can teach you. And then there's technology classes. So we all know that we can all use a little technology help here and there. So that is the live teacher. And they're always changing it up. They're always adding new stuff. But it's very simple. It's just these categories. Very simple to look on this and say, okay, the coffee chat is at 1 o'clock on every day. Coffee chat every day at 1 o'clock. So we try to keep the guide very simple for our users.
Can I interject you for a second?
Absolutely.
So you also notice here that the body moves is hosted by Caesar. So Uniper, the company, is providing Uniper services in the United States, in the Middle East, and in Russia. What they do is they procure these leaders, these trained leaders who are subject matter experts in whatever they're doing, and those are hired and vetted through Uniper. Uniper itself, one of the founders was based out of Brooklyn, New York, actually, and his mother was progressing in age, and she was battling dementia, and he was concerned, I don't want her to go into a nursing home per se. I want her to stay in place and continue to age while living at home. And so he and a couple of his other friends kind of pushed this forward and created this Uniper program, which is now they're technically headquartered out of Israel, which makes it really fun for us because we get to be on calls when people are practically in bed at times because of the time zone change. But we get to learn a lot from the folks over there, from Michelle and her team. But these live programs are generally hosted by a trained individual who is a subject matter expert who's been vetted by Uniper. So if someone goes into a program, they're in good hands. And if we join this program here, I'm sure you meet my thoughts so that I don't interfere here. Okay. So this is hosted. I'm not sure why there's a loading screen here. There we go. So the behind the scenes of Uniper is Zoom and YouTube. So their live programming is done through Zoom. So he has a laptop in his training room here, and he's projecting through Zoom, and we joined in on Zoom through Uniper. So over here would be where the individual, the member can see themselves and see where they are in the room. Down here is the camera and microphone. So what was your name?
Stephanie.
Stephanie? So Stephanie, I'm going to give you the remote. And if you... So if someone joins a live program and they don't want it in the camera, do you hit the OK button for me? Well, now you turn on. Hello. And then if you click over with the red button, if you hit the microphone, if you hit OK there, here. No, that's okay. If you hit the OK button here, you can unmute.
That's how you ask.
This is, we're gonna leave before he gets curious about what we're doing here. So,
So I think if it's not really a voice participant, I think that was the issue was
Yeah,
that this one
they
is
don't want
not an
people-
interactive class. So if it was an interactive class and you wanted to turn your microphone on and off, you would be able to do that.
That's the question I had with some of these. Could you ask a question if you had one?
Absolutely. And the microphone is directly in the remote. So it's right there with you.
it's kind of like a little, like a handheld mic.
Yes.
So you can hit the mic and then talk into it, that's Elvis, that's definitely Elvis for name that tune.
Yeah.
Or just unmute yourself and put it away. You can also use the center button here to manually turn it on if it was a space where you can actively talk whenever you want to.
And if you go down, okay. So if you have something that you're really looking forward to that sparks your interest and you want to send a reminder, you can go ahead and set the reminder on the corner down there and confirm. And then a few minutes before it's about to start, it will pop up and say, hey, this is on at such and such time, just friendly reminder. If you set it and you don't look at it, that's fine too. The one thing that's really important about this system, you cannot mess it up. You cannot give it a bug. You literally cannot mess this system up. So that's really important. This you can mess up. This you cannot. It's literally impossible to mess it up with that remote or anything that you do with it.
You have to have your TV on to have the reminder.
You do, yes. 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 It also interfaces with cable television. So on the remote, there's a home button, and then there's a TV button. So you can flip back and forth from your cable to your Uniper just like the remote button.
So you don't have to have two TVs taking it straight.
Correct. Yes. If you have like
two remotes, now you do.
you have to have two remotes, but to switch back and forth with cable interface, you do not have to do like your output, like the source button where you have to do HDMI 1 or HDMI 2. Now, if you were to have like a smart TV where it was like just Netflix and things like that, then yes, you would have to do that type of a switch to get from the Uniper to that. But you don't have to ever have two televisions.
If you have an email, you could program reminders to be emailed to you. So you get an email saying, hey, later today you have so-and-so going on. If the person has an email, they can do that as a reminder.
So basically you have gone down and taken everything that we could go to individually, like go to get set up, go to Zoom, go to YouTube, and find all of these things, but it's all here in one neat pack.
So if you think about it as a virtual senior center, so we can go in here and we can participate in activities that a senior center might offer, exercising, maybe a cooking class, just, you can learn, it's for your well-being, it's just a lot of different activities that you can do live with other people.
Right, but I guess again, what I'm saying, I could do that on my own if I went right through that program.
Yeah.
So what you guys are doing, like I said, is
Yeah.
putting it where older folks that aren't maybe that savvy don't have to worry about searching YouTube, etc.
Yeah.
It's all right here.
Yeah.
And then all subscriptions are free because it's still there,
Yeah.
if it wasn't charged.
Yeah, you nailed it. Everything that an older adult might need has been curated by Uniper and is available on here either through the live programming, and we haven't even talked about the pre-recorded library. Everything in there is designed or put together to stimulate the older adult, especially our isolated and or lonely older adults or older adults who have different levels of dementia. There's a lot of videos on here that are designed to stimulate that person. And I'm jumping ahead.
No, you're
here, I
fine,
apologize.
absolutely, yeah.
If what we've been seeing more of is scenarios where we have the older adult who presents with some level of dementia or other cognitive impairment, and then we've got the caregiver. And so for both of them, there's a path here to have a Uniper TV kit and then a handheld tablet for the caregiver. And so the care recipient might be using this, and I'm going to use Carol as an example. So we have this one member, Carol, whose husband has dementia. She may use him with the Uniper TV kit, set him up for a half hour during the program while she goes and takes a shower, makes food, does little things around the house while she's preoccupied with the device. Vice versa, if he has to go to the hospital or to the nursing home or go somewhere for an appointment, she has the tablet with her and she's still doing things that are stimulating her brain, stimulating her mind, and keeping her going. So in a way, it offers respite in the home and outside of the home, but there's capacity for both of them to
Well, we find a lot too with caregivers that the person that's caring for monopolizes the television. They never get to do what they want to do or watch what they want to watch. So that's where the tablet comes in fantastic, because they can actually sit with headphones or sit in another room, right on their tablet, and participate in all of this stuff too, for things that they like to participate in. So that helps a lot that way as well.
When you open that up, today is Monday, I think that was what it said. Does it have like a calendar for like things that you have indicated you want to watch, or things that you have pre-selected or things like that, so that when you get up in the morning you can look and say, oh, today I've got such and such?
So it does not specifically have that, but when I go into the home to install the Uniper device, and every time I talk to them after that, we pick a few things off of the schedule that they might like or be interested in, and then we put them here. And so they can continue to do that, so that way they know that at this time it's this because I like this, and they know which days are fine. So we created this to help them do that.
And you'll find that a lot of the programs happen on a cadence, on a sequence. So what we're seeing is people expect to do some of the live programs at the same time, the same day, so they can plan around it, so that they have things coming up, social gatherings, appointments, whatever it is, they can plan their content around it. And there's also a one that is pre-recorded.
Sure, yeah. So I'm going to go with this because this is kind of much new to it. You all remember when the soap opera was on and we watched Guiding Light or Bold and Beautiful. We knew what time that came on, right? So it's kind of the same thing with this. Like, once they get something that they really enjoy, they know what time it's on because it's on the same time every day for a certain amount of days. So they've made it pretty simple. And then the other feature is the video library. The video library is this sheet here. I always take this in with me. It kind of breaks down because these aren't really the greatest description of what's inside them. But the subcategories under them on this sheet really tells you what's in there. So, let's go to lifelong learning. So in lifelong learning, there is history, biography, nature, documentaries, science, technology, gardening, sports, hobbies, TED Talks, audiobooks, and then the member request. If somebody would really like to see something on here that's not already on here, they can put a request in directly to Uniper, and it's possible that they will put it on here. So that's a big one for the Uniper radio, because there's a lot of pre-recorded albums in the Uniper radio, in the music tab.
Or documentaries.
Oh, documentaries, yes. That's a big one. A lot of people really like that.
If you go to one of those categories, there's another menu that gets you.
Go ahead and open that one. So these are all the videos that are available.
They don't have anything on snakes.
Well, there you go. You can request that. Let's see. If you wanted to go back out, it's as simple as just clicking your little back button. You can always just jump back to home.
This little back arrow here.
We'll pass the remote around so you can see how simple it is. So there's very few buttons on it. And like I said, you can push as many as you want. You can't mess it up.
Did you try?
Well,
I did my best.
You might go somewhere that you didn't necessarily want to go, but you'll get somewhere eventually. The music and culture, that's a very popular one. We have the radio, there's pre-recorded live concerts, classical music, there's Broadway and beyond. So there's a lot of really good things in there if you just want to play it in the background while you're, cleaning or, you're a caregiver and you want to put some light music on for your loved one, relaxing music. There's, mindful and relaxation, nature and relaxation and healthy living is our nature sounds. And on the screen, there's a lot of times there's like butterflies or something, a waterfall or something. So there's just so many cool things. We don't have enough time to go over every single one, but there's a lot of really neat things. You want to learn a new language, we can learn a new language. There's preventative care, meditation and sleep. That one, I don't remember when it was. That's like, I didn't go into it. It's like history. It's like, yeah.
It is fun.
Yeah. Yeah, that's right.
In the Uniper.
I wonder if they're gonna add more videos.
They will, yeah, they will.
Yeah.
We could add to that.
Go to the Uniper radio.
Oh.
What was that? So these are all pre-recorded albums that they can go ahead and listen to. Lots of good stuff in there.
I think it's that.
Got some Elvis going on down here. So this would be a good one that if you had a request that you'd really like to see on here, you could send that through as your member request. So yeah, there's thousands of videos on there, so you could, it would take you a while to go through everything, and there's lots to choose from.
And like Una said earlier, when we do the home visit to install the device, we try our best to align your interests with what's available on here, because we realize it's overwhelming. The sheer amount of content on here, 3,500 hours of content on here that's supposed to be recorded. We like to align it with your interests, and Una has a really cool handout to make sure that we track those things, so that you know, exactly, where you want to start, and then maybe you can support.
When I go into the home, it usually takes me an hour and a half or so to do the installation. I mean, it takes probably 15 minutes to set the whole thing up. But the rest of the time is sitting and visiting and learning about that person and what their interests are and what I can, can pick up that they might enjoy on this device. That really helps. So it's not just, here's your device, have fun. You need me to call you. We don't, it's way, way much more than that.
To be practiced with kids.
Yes, yes. If they would, like, after a month or two, and they're like, this really struggling, I can't get it, give me a call, I'll come out and spend some more time with you. We really want to keep this on an intimate level with our people so that we know that we're getting the largest benefit out of it.
Along that thread, there's a tile, so these are all, I call them tiles. These are all tiles where I can just go across these and look at the different categories, and it brings me back to the beginning, so to speak.
Mm-hmm.
So, Deanna is not lying to you when she says you can't break it. You just press all the buttons, and you're just this is a self-enclosed ecosystem. What I wanted to show you here was, this welcome tile is kind of like an orientation.
It's not on ours.
It's under review.
No, it's just not on our demo.
Oh.
It is on the actual one that we install with the people. I don't know why. I'll have to call them and ask them if that came up before. Because I rechecked to see if it's on there. But when we first turn the device on for the very first time, a video will come up before they can even go anywhere else. And it's a little guide and tutorial, welcome to Uniper, and it goes through each one with them, and I'll sit there and watch that with them. That's very helpful. But they can also go in that section, and it will give them different guides and a tutorial on how to use that if they forget stuff. So the next is the calling feature. This is where they would be able to add their friends and families in order to video chat with them. They can video chat, and then they can also send them photos. So there's a photo library tile in here where they can store photos of their friends and family. So how this works is they would put add contact, and it would require a cell phone. The person gets a text message that says, Deanna Halleck has requested you become part of her Uniper contacts or family or something like that. So please download this app or something like that, and it walks them through downloading the Uniper app. In their Uniper app, they can call their family members. They can send them photos of whatever they want to from there as well. You can also call them, so our members are able to reach out to their family members directly as well. So it's kind of like an iPhone, when you do FaceTime. It's just exactly like an iPhone. And it's on television.
So these are our coworkers on here who are graciously volunteered their contact. So once you add that, like Deanna said, they would get a text. They can download the Uniper app directly from their smartphone, and it's no cost to them. They won't have access to all of these programs and services, but they'll have access to their family members' network, and so they can call, FaceTime, or send pictures at any time. I like to point out here when this camera captures a wide view of the person in their home. So especially for that, I think of my mom. If my mom has this and I call her, I can see more than just her face. I can see her body, I can see her surroundings. As a caregiver, sometimes it's nice to see what that person's aspect is like. Are they taking care of themselves? Is their environment looking okay, or are there any red flags that we need to be worried about? So this call feature is really neat for that.
We've had people say, it's really helpful because I have to call my mom or my dad and remind them to take their medication. So not only can you call them, but you can physically see that they've taken all of their medication. So when they tell us on the phone, sometimes, yeah, I took my medication. Well, did they really? We don't always know that, when somebody is in the beginning stages of dementia, sometimes it's difficult to tell. So it does help caregivers a lot in that way. Right now we have a caregiver using it with her husband. They have the tablet and the unit TV together, and they go to Florida for a couple of months in January, and they're going to take a tablet with them. So when she has to run to the grocery store, she can call from her cell phone, lay eyes on her husband, and check in and say, just checking in, are you doing okay? So, and it's very simple to use. So we're actually in the process of making note cards for him, and it will benefit other people as well. So it's simple directions on how to navigate through this. So sometimes people are better with a physical picture than they are reading directions. So we're trying to make it as accommodating for every stage of life as possible. So that's the call feature. The photo
Yeah, it's all really clear. It should be next to the call feature.
So this is where their photos would be stored. So I don't know if you've noticed when we flip back and forth between tiles, like a little announcement will come up. So once they get, I think, to 6 or 7 photos, their photos will pop up when they switch. Like right here, this is where a photo would pop up after they get a certain amount in their photo library. We have games that are all for the stimulation of the mind. Who's our game expert?
I don't do as many home visits as Doris and Indiana do, but my home visit time is probably double theirs because I'll sit down and be like, oh, actually, look at this game right here. And we're playing, and time is flying by.
They really enjoy like the word games. A lot of them enjoy the word games.
These were really a lot of fun, especially for the members who have any sort of cognitive impairment or are afraid of future cognitive impairment. They're keeping themselves sharp while playing some of these memory-seeking games, and there's a bubble shooter, and then an exercise game here.
I haven't been into that one yet.
I haven't done this one yet either. This one is new. They're always adding, they're always iterating. Their research and development team is always looking into different things to make the system better or make it more diverse.
Right, and being there as a video library, obviously we have to put new updated material every so often. If somebody product and they only have this amount of material, and then once you've been watching it all, just when you do it then. So they are always refreshing those.
I think I accidentally clicked into the game,
Oh,
but it wants to like play.
It's not in the person. That's what it wants you to do.
I don't know if I should do it.
There you go. That is always.
You know what happened?
I don't know. Maybe I can help.
Like they have to move it.
It's supposed to send to, I think if I could do it, maybe it's right. I'll have to investigate that one.
That's fine. I wonder if the
Kinda like a
camera
lead.
was like further away.
Yeah.
Huh.
I have a question.
Sure.
You keep mentioning that this is all for in-home. So what if someone is in assisted living?
I'm actually going to visit a Loveville Manor next week. I'm going to talk to the activities director and using it for her activities, but also to offer it to people who are residents of it at the assisted living and nursing home, because it would be great for the people who don't have a television or something
that could use it, so yeah, we can offer it. to
Yeah,
them as
so it
well.
just depends on the individual criteria, whether or not they qualify, even though they're in a assisted living.
They just have to be 50 or older, we don't care where they live,
That's it?
yes.
There's always more than that.
There is, until we hit 75, and then, like I said, you have to reevaluate at that time. We will, if there's over 75 participants or members, then we will go back to the drawing board and say, okay, so is there a great enough need for us to rewrite our grant and get more? Or do we have a waiting list? You know, that's what we will do at that time.
So you have 30-some already,
34, yes.
and your goal, you have up till 75.
We have capacity to sustain 75 members.
Okay, so if some of, so you're presenting now, so if some of our members did it, that would be included in those numbers. If they waited for another half a year, it may be on the waiting list.
Correct. But at that time, once we hit 75, we might reevaluate our eligibility criteria at that time. But right now, our goal is to get it out, get the word out, so we can get it in the right hands. Right. And when we say 50 or older, that doesn't mean somebody who's 40 years old and has a disability and is basically homebound and isolated or, you know, lonely, whatever. They would also meet the criteria. And we're pretty flexible that way. We just, our funding process, you know, we have to keep it within New York, we keep it within Allegheny County, then in federal.
And so we know that if somebody now, this year, like, says, like you just said, yes, we're very interested, and we would come out and assess and do all that sort of thing and set it up, we know that for 3 years, is that your funding, 3 years this is available.
So,
And after that, there may be a fee.
You would probably have the option to keep it and pay the subscription fee, or yes, we would have to remove
Or you
if the
could
funding was no
remove
longer
it.
available.
yeah, we would seek renewal funding either from our Distributing Foundation or from another foundation in Western New York to continue sustaining
We're
that
hoping that
program.
that happens. If it goes over well enough that we can ask for more funding and continue.
The red tape that Mary was talking about is just every 3 months you would have to do sort of resurvey.
Yes.
Yeah.
And for our more, a lot of our participants, we can do that over the phone. We don't necessarily have to do a home visit. We have the option, we can video chat them, I can video chat with them right from my office. So there's a lot of different ways that we can do that. What does this survey content? I have one.
Where are you looking? So if you qualified in, Western Allegheny County, whatever county, and then you are a snowbird and go to Florida, you take it with you, is that still?
Yeah, and we can provide support through the phone, and there's also, you're always going to see this number up here, the 888 number. That's the number for Uniper support program. So we'll notify them that, hey, so-and-so member is going to be moving, and so that they know when they see the alert come in, it's not, hey, this person is a New York resident, but they're calling me from Florida, you know, what's going on? They'll know, hey, this number is snowbirding, because I think we already had 2 or 3 either leave the state and go south or relocate from this area to Western New York to like Hamburg, Virginia area. So for us, our entire system is built on, we get a referral, either a self-referral from a community member or a referral from a doctor's office or a referral from the Office of the Aging or a referral from an outreach event like this one. We would call, confirm their interest, and then do a home visit risk assessment, make sure that what we're walking into is nothing scary, you know, nothing, oh my gosh, no, should we be doing this or not? Generally, there's no red flags.
And this is the intake from the information that we have. That's been designed as a technology loaner program. We understand that accidents happen, sometimes things get dropped in the break.
all we ask is, just that they let us know so that we can get it and replace the good guys. And it's kind of a, we look for different signs, for each member, if there's somebody who's requesting a new one, for the third time, we don't have to reevaluate things, but we do understand that accidents happen. So, our goal is, we don't have the goal of making them pay for anything. That's not right.
And so at the home visit, there's paperwork that we complete. We get the device installed and up and going. We do your interest survey. So, what hobbies, skills, or things motivate you, what brings you energy, and we try to align that with what they offer on the device. There's this intake packet that you complete. There's some demographics, and then the two surveys that Deanna mentioned earlier, the PHQ-9 and the UCLA Loneliness Scale. And then there's an agreement form. It's very important for us to capture some of this information because that's what the funder requires for the funding.
That's the red tape.
That's in essence the red tape. And so for us, our hypothesis is if we identify individuals in the community who are isolated and they're lonely, we know that through our age-friendly Allegheny County work, we've been, the last 8 months or so, we've been doing a lot of community conversations based off of the global cafe model where we bring people together into a space. And often we break bread, and the purpose of the community conversation is to talk about in what ways are you affected by isolation and loneliness, either you yourself or someone in your community, someone in your vicinity, or a loved one. And the reason why we care, there are a lot of key health markers that are showing poor health outcomes for individuals who are isolated and lonely. Late last year, the Surgeon General put out a report. This report indicated that someone who's isolated and lonely is suffering the equivalent health impact to someone who's smoking 17 cigarettes a day. That is pretty jarring and pretty striking for us because we know that there are folks, in Allegheny County at least I know, 70% of our older adults live alone, either by choice or they've lost a partner or spouse, their family no longer lives in the area, and they have no. That doesn't mean that living alone is an automatic health marker.
Right, we have some people who are perfectly fine living alone.
We have a few.
They enjoy it, but that doesn't mean they can't benefit from it.
And then there's folks who are living alone not by choice because they're either disabled or they don't have transportation, they don't have the resources to get out and be social and engage in the community. And that's where something like this, that virtual community center, comes into play. Dementia, heart disease, diabetes, all increase risk-wise if someone is presenting with isolation and loneliness. If we're not leaving our home, what's happening to us? You think about the old rubber band. That's okay. The rubber band scenario.
Shoveler.
Oh,
A new one.
That's good.
It's very essential.
Very essential. You think about the rubber band, right? It's in the drawer. You don't use it, you lose it. Someone is sitting at home. They're not maybe being active. They might not be making the best health choices. They may be engaging in behaviors that are negative behaviors for their health. Maybe it's eating, maybe it's not moving. That's where this kind of kicks in to address some of those ancillary factors that can prevent hypertension, diabetes, also the brain plasticity from getting too stiff and increasing the risk of dementia. So that's where that data component, measuring the PHQ-9, measuring the UCLA Loneliness Scale every 3 months or so is so important for us to go back to the funder and say, hey, this is working. We're either keeping steady or we're seeing decreases in isolation and loneliness, especially for our regular population. So that in and of a nutshell is the entire program.
So no, not really, because I have one more question that's really important, and it's going to be important to you as well.
As far as the behind the scenes work,
But yes, that is for the actual, user or member, that is the basic.
and we might check in every now and then, hey, how's it going? You know, what's working, what's not working, and get feedback and insight. But that's kind of the bulk of the grant work.
So the very last part that I say is really important to all of us is, with this program, we have the capability to do our own videos and broadcast them. So if your company wants to do a happy holidays little video and stuff, we could put that on. If I don't know who I would talk to in the group, but I'd love to connect with somebody to give them regular updates on community events and things that are going on, so that I can put that on here, and I'll say where we store those, so that our members can see that. Let me show you that. So they have the announcement board, and if you have a flyer or an event coming up with information that you want me to put on here, they can go into, they always have their monthly schedule, but I have one on here. So right now we are doing a vaccine clinic, 3 different locations. This is not a very good example because it's not very good quality, but so we could put pretty much anything on here that you that's the So that's very, very helpful for people who don't get to get out or don't know what's going on in the community. So, and like I said, we are hoping in the future to do some fall prevention videos and some different things related to that. About our own.
If there was one tiny silver lining from the pandemic, it was the growth of online programming. And when I say that, I mean a lot of the work that we do is evidence-based or evidence-informed, which means that it's been piloted, it's been tried and true, there's been trials and studies completed on it. What the pandemic did was it shifted those folks into doing that same testing, but virtually, which then allows us to offer some of those programs like our A Matter of Balance fall prevention program. We could offer it online, and if we have a good cohort of people who have Uniper, are interested in fall prevention, we can set up a course right from their home and do it as a community. Another really cool pilot program that we're doing right now over in Belmont at the Fountain Arts Center is our Musical Memories Cafe, which if you haven't heard of the Musical Memories Cafe, our friends in West Falls, close to just north of Finley Lake, they've been doing Musical Memories cafes now for about 6 years, and it's a really cool concept. For an hour, older adults and caregivers are brought in for a meal, a socialization opportunity, and we also play live music. So I bring that up for 2 reasons. One, it's possible that we're procuring funding right now from the Ralph C. Wilson Foundation to expand this model and maybe do it in Allegheny and General County, which would be great because so far we've done 3 in our small pilot, and we're seeing a lot of great results. People feeling their stress going down, feeling more supported, more connected, especially the caregivers who are independent. And while it says it's only for an hour, it's really more like 2.5 hours. People come early. People get there half hour, 45 minutes early, and then they stay 15, 30 minutes afterwards because they're sitting at their tables, they're talking, mingling, and socializing. Some of the folks stay and talk to the band afterwards, which is neat. Or we have a lot of resources there, obviously the Aging Connect, the Alzheimer's Association, our information is also there. So it's a socialization opportunity, food, we always love food, and then also community building. The second reason why I bring it up is we're looking to record these and offer it as a concert series on the Uniper as a different sort of programming. One thing that we've talked about is it's nice to see these concerts and these things happening in other countries, in other cities, but what about in our backyard? And so we're looking into how might that work necessarily, because it takes a lot of protected ABI. So that's kind of like one of our pies in the sky for next year, to offer one more thing on the platform.
Kind of similar to the coffee chat happening every week. We talk about just doing one where people can join just to have lunch together, maybe from their home, and chat, we talk about it, eating their lunch, things like that. So lots of different ideas, we love suggestions, questions. What do you think?
I think it's fascinating. I think I'm interested in your how you measure loneliness being reduced in people or whatever. I always found that because it's subjective, and if you do the funders go for subjective. I mean, how do you know it's lowers blood pressure once you take the blood pressure before and after and all this stuff? I mean, scientifically, it's difficult. But I always found that as an impediment to writing grants. We're trying to prove that.
Right, and that's always a conundrum with grant funding. So we go through self-reported data, and that's the PH29 and the UCLA loneliness scale. It's self-reported data, and the numbers, the numbers get calculated. So you get a score, like on the PH29, someone will get a score either from 1 to, I think 28 is the highest, and we can see that and track that over time. Also, through Uniper, we can see like what's usage look like as a group. Or is usage overall, is it trending upwards? Is it trending downwards? If it's trending downwards, what are some things we can do to make sure that it's, we'd like for people to use it for about an hour. In Uniper's research, they found that if a person uses it for an hour or per week or 4 hours per month, that their health levels, their health indicators generally are have good thoughts. I'm gonna struggle with this, but prognostication. Like it's a good thank you if they're using it for an hour a week or 4 hours per month, which is really good indicator for their overall health.
We have super users who use it for thousands of minutes. And I have those that we can keep track of it on the beginning of the whole, and then we can do the contact with can I help, do the training, what kind of things do you like to see the conversation? Or maybe they're not feeling well, so maybe they're in the hospital. So it's a really good way for us to keep in contact as well.
And the partnership there, I think it's very useful. It's really good tool. What for us? What are the next steps? What do you think?
Yeah. So, if you self-identify with the device and want one, or if you identify someone in your community or in your village who you think, hey, this would be really good for them, get a hold of Deanna, and we'll complete a referral. We do referrals either by phone, by email, or we have a online link that someone can complete. We find that the online link is the easiest, just because you can fill it out whenever you want, and we should have all the information on there. But call or email is really good too.
You can email me directly, and you can email me your phone number, so I can, reach out to you and have you remind me of that. But it would be great to have it, just to get, your perspective on,
Yeah.
suggestions.
So it doesn't have to be just for people who live seniors, well, maybe for couples.
Yeah, it could be for couples, for families.
Yeah, I have some couples that use it consistently, really use it. How easy would it be to put an Apple AirTag on here so we lose
Yeah.
That's a criteria going like an hour, that seems very.
Actually, ours, we started out at 2 hours, and then we just recently learned that Uniper only, their minimum is an hour. So,
So you wouldn't pull it from somebody if they weren't,
We have a
if they
few,
weren't using it, that doesn't seem like good usage.
we have a couple members who we've seen their usage drop off pretty drastically, and so we follow up and check in. What we discovered was the one member was in the hospital for 2 months.
Right.
They had something happen. Another member just didn't feel comfortable using it, and so that's where that retraining person went out and made sure that, hey, this is what's going on, this is what we're doing, made an action plan with them, and we've seen the usage go up. We haven't had a scenario where we've, hey, you're not using it at all, we're going to take it back.
Right.
We haven't had that, but I think when
We should give out the 75,
when we start getting close to capacity, we'll have to look at that more strictly. If someone isn't being coached into using it, or if they just wanted it to have it, and they're not really using it, then the data is not going to reflect well, and
Right.
we'll have to have that conversation with them.
We ran into one scenario, so when you're explaining this to somebody, you might have to make this clear, is that the internet hotspot is specifically to run gaming. We have some techies for adults that, set it up to stream their Netflix. Which, once it gets to 40 gigs, then it lags and won't even run the unit. So we want it to be, used for this. Now, if you want to download a book or something on a tablet, we're pretty flexible that way. We can't really stop them from doing that, but we do keep that thing. It doesn't, like I said, the 34 was only ever had one person that really kind of took advantage of it.
Great. So you should be hearing from some of us, yeah, this is just part of the 88 members in our particular village, but not everybody could be here, but this will, I am sure that this will be useful for some of our members.
Wonderful.
Right?
Could we send you, for the folks that were here, could we email you these forms?
Yeah, why don't you can email Liz.
Liz?
Right, Liz?
You have I've got my card.
And we'll,
Okay.
our general email is where you can reach me.
Oh,
It's
okay.
at Mountain Village.
I'll connect you there. You keep your card, if not, I can, actually will give you one. Okay.
I think,
Yeah.
well, thank you for your time today.
Thank you, this is very interesting, and I think it's a worthwhile project. And it seems, especially if you're tutoring, you're coming in and helping, but you won't leave until that person, the person knows how to use that little device, correct?
And it's a
Yeah.
How often are you checking about how often are you checking
How often are,
We do,
Oh, I know.
3
I couldn't
days.
hear the question.
How often do we follow up? So once I do the installation, I usually follow up within a week, just to see how things are going, if they're having any issues.
And then after that, I'm trying to reach out to them at least once a month. There are some who require a little bit more. It just depends on the individual. But the goal is after that, at least once a month for me.
If you're not gonna be able to keep that up, and you get
Well, we're hoping-
75.
No, we're not. If we have more than, up to 75, we're probably gonna, we need some more hands on deck and
Right now, there are the two of you, you're the main person.
And Larissa is helping as well. He does, Larissa is very involved as well. She does the caregiver aspect of it, runs a couple of different programs. She does the musical memory cafe. The Growing Stronger is, exercising group that's in each town, in our county, in Allegheny. We have a volunteer who runs it, and Amy is one of the for the exercise. But she does help with encouraging and all that.
It does look simple, I mean, it is,
Yeah, it's ergonomic, it's simple, it's colorful. There's a little tutorial game when you first open it up that'll walk you through how to use it. It's really neat.
simple boy.
Yeah, everybody needs
Bigger.
Yeah, you know, here's
I
the
always
wrong.
hit the wrong one, and I have to go back, and they drive me